Good afternoon, everyone. This is County Executive Pat Ryan. Thanks for joining us for our COVID and vaccine update. We'll try to keep it brief today. At the high level, as I usually talk about, there's kind of two main trends we're looking at: infection rates and vaccination rates. So on the infection rate side, our COVID numbers are slowly declining, but they're really remaining what I would say is, as I think about it, stubbornly high right now, where our new positive rates are still higher than we'd like. Our active case count is higher than we can have. And so we have more work to do to bring those numbers down. On the vaccination side, we continue to make good progress, and we're at just shy of 50% now of our residents vaccinated, putting us well ahead of the state average, but we have a lot more work to do there. Going deeper by the numbers, right now, total cumulative cases in the county, 14,342. That is out of over 346,000 tested now since the beginning of the pandemic, 12,635 recovered, and unfortunately still seeing loss of life, 2 more fatalities in the last few days since our last update, bring us to 249 Ulster County residents who we've lost. So for anyone still wrestling with whether the pandemic is real, it's very real. It's very real to those two and their families and their loved ones. It's also very real to those that are hospitalized right now. Our hospitalization numbers are still higher than we'd like as well, with 13 hospitalized in Ulster County. Another number that's stayed stubbornly high in the low teens. 4 of those 13 on ventilators in ICU beds. So even as the pandemic goes on, it still does what a virus does, and unfortunately targets those that many of us know and love. And so we have to continue to stay vigilant, even though it has been a very, very long 13, 14, 15 months since the beginning here. Looking at our active case count, again, this is a number that is still too high. We believe primarily due to the increased prevalence of different variants, in particular the UK variant and the New York variant, to use their kind of nicknames. We're at 1,458 active cases. As you can see on the graph, we did, over the last week or two, start to see that number come down, which is encouraging. But then in the last day, too, the active case count is back up a little bit. So we definitely have, as I said, more work to do here to bring down that active case count. That starts with sort of stopping at the source, which is new infections each day happening due to people not following protocols and the increased ability to transmit COVID due to the new variants. So right now, over the last 96 hours, Ulster County is at a 4.08% new infection rate, 4.08%. That means that over the last 4 days, we've tested 5,052 residents and had 206 new positive cases. As long as that number, as I always say, stays above 1 or even 2%, we'll continue to see far too many hospitalizations and fatalities. If we can get it back down to that 1%, where you can see on the graph we really were for much of the summer and fall of 2020, then we can keep our those most concerning numbers of hospitalizations and fatalities down, or hopefully get them to 0 while we work to get the vaccinations up. Hospitalization capacity has not been a problem. Hospital and treatment capacity has not been a problem for several months, and still remain in that situation where we have more than sufficient need there. And again, as always, definitely in broken record territory by this point, but is just absolutely critical that each of us remain vigilant with those infection numbers so that, one, we slow the spread, wearing masks, maintaining distance, avoiding social gatherings, and washing hands. That slows the spread, gets it down to a more controllable rate, and really what that does is it buys us time. It buys us time to get the remaining half of our residents or so vaccinated, which we know is going to be a difficult task. I think it's clear to us each day. It's more clear to us that the second half of getting the second half of our residents vaccinated is going to be much more challenging for multiple reasons than the first half. We've solved the supply problem, which is good. Now we're going to have to work on the demand problem. So it's the inverse challenge that we had 2 or 3 months ago, and we are working multiple different strategies to get to that and to impact that. Our vaccine allocation for this week, as usual, at the time of this briefing on Tuesday, we usually only know what our health department has gotten. I don't have always full visibility, usually till later today, on all of our other partners. So as always, tell you what we do know at the time. Right now, Ulster County has been allocated 3,600 vaccines. That's to our health department and to few of our partners. We don't yet have the numbers for the state site or any other additional partners that may get added. So we'll update you all if and when we get those additional numbers, likely tomorrow or Thursday. But again, 3,600 total vaccines. You can see the locations for this week, primarily still happening at our Hudson Valley Mall pod site in the former Best Buy location, and then 3 other partners who received direct allocations from the state, 1 pharmacy and 2 of our medical providers. The other big addition that I want to talk about is that in addition to these sort of fixed sites, we've rolled out a strategy this week, started yesterday in Marlborough, and continuing today and into the weekend, where we're having mobile walk-in clinics, meaning no appointment required. We'll come to you, we'll come to your town or your area, set up in either a town hall or another building that makes sense, to try to make it as easy as possible for folks to just be able to swing by that location throughout the day, not have to pre-plan, although you can, if you want, pre-book an appointment. So details about those walk-in clinics that we're now doing and hoping to continue and frankly ramp up. As I said, yesterday we had a successful one in Marlborough. I want to thank Supervisor Lanzetta and his team, as well as Legislator Corcoran for their partnership on making that happen down in Marlborough. Today, as we speak, we have our second walk-in clinic happening out in Shandaken from noon to 7 p.m. So if you're watching and you or anyone you know is out in the more western part of our county, please share this information with them, that our team will be there until 7 p.m. right at Shandaken Town Hall on Route 28. You can both pre-book appointments, and there are still appointments available online, or you can just walk in and get taken care of there. And then on Saturday, we'll do another walk-in clinic in Ellenville at the high school from 9 a.m. to 5 p.m. And again, same setup. You can either pre-book or walk in, trying to make it as easy and painless as possible for folks. If you've already been vaccinated, that is great. And now the next thing that you can do to help is reach out to a few friends who you know, encourage them to be vaccinated. If they haven't, and if they haven't, share this information with them about how to do so. We all need to feel empowered and feel some responsibility to not only make sure we get vaccinated, but to politely and respectfully, but to urge and encourage our friends and neighbors and others around us, because until we get to that herd immunity percentage of 75 to 80%, everyone is at risk. If we don't, especially those vulnerable people who might not have been vaccinated yet. So where are we as a county by the numbers? We, as I said, continue to make great progress here. We now have almost 88,000 Ulster County residents that have received at least their first dose, over 59,000 who have completed both their first and second doses, or a single dose for J&J for those that got that previously. That puts us at 49.3% of our total county population who have received at least their first dose. That is the good news. The challenge, of course, is that remaining 30, 40, 50%, at a minimum 30% to get to herd immunity. We know that's a group of people for whom there's a combination of possible hesitancy about the vaccine and many barriers and challenges to accessing the vaccine. So we're doing everything we can to be creative to engage community leaders that are trusted to address both the hesitancy concerns as well as any logistical or access concerns. If you're aware of folks that have those concerns, please reach out to us on their behalf and we can work with you. If you're a community leader, whether you run a business or a not-for-profit or you're an elected official or anyone who can reach out to a few folks and you want to host a vaccine clinic, we'd be excited to work with you. We can come to you again and try to remove some of those logistical challenges. So those are the kind of strategies we're hoping to adopt, and we are very open and frankly in need of other good creative ideas to get the remaining balance of our residents excited and engaged to be vaccinated. So please reach out with any of those ideas. For those that do want to share information or need to sign up themselves, I'm guessing that most people watching today probably have been vaccinated, but if you haven't and you want to be or you want to share with others, please direct them to our single point of kind of information and action, which is vaccinateulster.com. That's where you can go and get all these details plus more in terms of upcoming vaccine clinics, frequently asked questions. If you know people that have hesitancy about the vaccine and have medical or health-related questions, we have expert answers from our medical experts up in the frequently asked questions on our website. So if you want to be informed to address those concerns, you can check that out. That is all at vaccinateulster.com. If you're not able to get online, you can always call our recovery service center via phone to talk to one of our team members directly that can help you. That's 845-443-8888. Finally, if you or folks you know have transportation challenges, which in a county the size of Rhode Island is a very real challenge for many folks, we have been and will continue to make our UCAT bus routes, the existing routes, are free, so no charge for anyone who is being vaccinated, and you can just get on a bus, show your appointment, and ride for free. For those that are seniors or with disabilities, if you call us ahead and just give us a 24 hours heads up ahead of your appointment, we can come directly to you, door to door, curb to curb, and bring you to your appointment and back. So please don't let transportation be a barrier, and please especially share the word about this. I was on a call this morning with some community leaders about this, and a few of them weren't aware that we do have these transportation options out there, and I know that is a real challenge for folks. So we are excited to work with you and support you, and thanks to our great transit team at UCAT for the work they're doing to help get people vaccinated. If you want to help in another way and are willing to be a volunteer at one of our pod sites, you can sign up to do that at ulstercountyny.gov/volunteer. You will be paid a stipend for all of our volunteers. We need both folks with medical experience and qualifications as well as non-medical volunteers. I was out there as someone definitely not with medical expertise, but was a real privilege and a pleasure, honestly, to help our folks at the county pod site get vaccinated. For those of you wondering whether that's something you want to do, we have at least 5 or 6 of our volunteers that have been at literally every single one of our pod clinics from day one, working long days for little or relatively little or no financial pay, although now we are providing that stipend, but really doing it out of service to our residents, and I want to thank them for having done that and continuing to do that. The last thing that I just wanted to hit on before we wrap up and do other thank yous, this morning I had the honor and privilege to speak at the Ulster County Chamber of Commerce breakfast meeting. Unfortunately, it wasn't in person, it was virtual, but I want to thank the Chamber for hosting myself and our Director of Economic Development, and also thank Radio Kingston for helping live broadcast and record that as well. I wanted to direct your attention to that because for folks that have questions or want to get involved in our economic recovery and resilience efforts, we talked for about 30 minutes in depth about our plans related to that as we come out of this pandemic, it's absolutely critical that we accelerate our economic recovery, that we really lean into that spirit of resilience that the community has shown in many ways and adopt that in our economic recovery to get our small businesses supported, to make sure all those who want and need to work are able to work in good paying jobs. So we talked about everything from our plans at the former IBM site, now called Enterprise West, to our plans to invest in a food and agriculture hub, our investment priorities in the health and care sector, and particularly on mental health and addiction, and also talked a lot about the housing crisis in the county and our plans to address the fact that well over 75% of residents in the county, whether you're buying a home or renting an apartment, are struggling to do that, and that is just completely unacceptable, and that really hurts all of our economy for many understandable and even maybe not initially clear reasons. That's a real problem that we're working hard on. So if you want more on that, please check that out. That's on our Facebook page or the Ulster County Chamber of Commerce page if you want to see those remarks. And I'd invite anyone that wants to get engaged in that. We're going to be doing more work coming now into the second quarter and into the spring related to our Ulster 2040 economic plan. And so if you want to get involved in that, please do be a part of what is a little bit more hopeful and optimistic of getting our economy re-engaged, which we've already done a lot of, but which we need to do a lot more of, and making sure that as we do it, it's really done in an equitable way that doesn't leave folks behind after this really, really incredibly difficult year. So special thanks to Tim Wiedemann for the work and the presentation this morning, our Economic Development Director, who's fantastic. Thanks to all of you for tuning in. Thank you to all of our frontline workers. Cannot say it enough, not just in words, but we're really trying to honor your service and your sacrifice with a whole bunch of actions that we're taking and investments that we're making. But we will not forget what you've done for all of us throughout this really difficult time, at risk to yourself and your loved ones. So thank you. And as we wrap up, our next update will be on Thursday at 3 p.m. If you need anything, call our Recovery Service Center, 443-8888, or go on our website there, our COVID-19 site. We're getting there. We are getting there. We really are making progress. If you think back to a few months ago, it felt very, very dark and cold and without much hope. And again, we have more work to do, but each day I feel more hopeful, more optimistic about how we're going to come out of this better and stronger, and really reminded of how much we need each other and rely on each other as a community. So thank you. I will see you on Thursday. Be safe and healthy and resilient.